everyone. Thank you for joining us for this COVID-19 telephone town hall with the Tri-County Health Department and Arapahoe County. If you'd like to ask a question tonight, simply hit *3 on your telephone keypad and an operator will come and take your question. If you're listening online, you can type your question into the question box on the website. My name is Dirk, and I'll be your moderator. Now, before we get into tonight's discussion, we'd like to remind you that if you'd like to opt in to receive future communications from us in the form of automated calls and text messages to the phone number you are currently calling from, you can press 1 now to be added to our list. For tonight's event, we'll be providing an update on Colorado and Arapahoe County's COVID-19 trends, as well as information about the vaccination rollout and distribution plans in this area. We'll also talk about what the summer might look like in terms of all those fun things we want to get back to doing this year, including the Arapahoe County Fair. We do have a lot of information to share with you, and we want to get to your most pressing questions as quickly as possible. But first, to kick things off, let's welcome Arapahoe County Commissioner and Board Chair Nancy Jackson.
Thank you, Dirk, and thank all of you for joining us. We're pleased tonight to be joined by officials from Tri-County Health. Now that 2021 is in full swing and COVID vaccinations are available to anyone who wants one, we're finally seeing the real possibility of putting the pandemic behind us. We still have a long way to go, so we encourage everyone to please keep doing all the anti-COVID practices we've been urging this past year. Our goal tonight is to share important information about what's next for Arapahoe County and to answer as many questions as possible. So please stay tuned and ask any questions you may have. We have a lot of ground to cover, so I'm going to hand it off to you, Dirk.
Thank you, Commissioner, for setting the stage and framing tonight's discussion. A quick reminder that if you'd like to ask a question, please press *3 on your telephone keypad to get connected to one of our operators. Now, let's bring on Dr. John Douglas, Executive Director of the Tri-County Health Department, to give us an update on the current COVID status in the Tri-County area. Doc?
Yeah, thanks, Dirk. Very nice to be with you. Appreciate Commissioner Jackson setting the stage for tonight's discussion. Let me say that the status of COVID in Arapahoe and Colorado looks cautiously favorable. And what I mean by that is that we've seen over the last 3 months of substantial improvement from the dark days of winter. And as we get more and more opportunities to get our residents vaccinated, that trend, I really hope, is only going to continue to improve. The cautious part of my comment is that we have, in fact, seen recently some increases in cases in Arapahoe County, the metro area, and really Colorado at large. There is some concern. You may be hearing some national experts talk about, gosh, is there any chance we could have a fourth wave? We had a wave in last spring. We had a small wave in the summer. We had a terrible wave in the late fall and winter, and we don't want another wave. I would have to say I think that is a possibility, but not a likelihood. I think you probably have heard a lot about the race between the vaccines and the variants. And I want to emphasize that I think that's a little bit where we stand right now. We are currently getting ever-improving metrics on vaccinations. We've got approximately 35% or so of our residents have had a chance to get a first dose. That's even better for our older residents. We started focusing on people first in their 70s and then 60s. And so appropriately, really, our older residents have had longer to get the vaccines, and that's really helped us out because they were the ones that were getting hit the hardest. But these variants are coming at us almost like alphabet soup. We've got one in particular of concern in Colorado. It's from the UK. It's got a number attached to it, B117. That's really not alphabet soup. I guess that's number soup. But we tend to call it the UK variant for shorthand. It's concerning because it's the one that sort of set our friends in the United Kingdom back on their heels back in the fall and the winter. It is currently creating lots of problems in Western Europe. France, for example, had to enter a third lockdown last week. It's causing problems in Canada. I've got grandkids in Montreal, so I pay attention to that. And they're seeing really increased rates as well. It does look like the UK variant is spreading across Colorado. It's now probably, we believe, somewhere around 40 to 50% of all strains. And it's important because it seems to be more contagious. It's about 50 to 60% more transmissible from me to you if I happen to catch it. It also appears to be more severe. That is, people who catch this strain do appear, at least based on experience in the United Kingdom, to have a greater likelihood of getting sick. So while the current generation of vaccines that we have do appear to work really effectively against it, we really don't want to take it for granted, because a variant spread could further set us back. Again, it's happening in some countries and even in some states in the U.S. I do want to emphasize the vaccination story otherwise looks very good. We now have 3 vaccines, as I think most of you know about. 2 of them are based on RNA. They are 2-dose vaccines from Moderna and Pfizer. And then about a month ago, we began to get limited access, but we hope that's going to get better, to a Johnson & Johnson vaccine. It's based on a slightly different biologic format. The really wonderful thing about it is that it produces almost as much protection as the Moderna and Pfizer with a single dose. So it's sort of that one-and-done kind of vaccine that I think many people are quite interested in getting. So we're eager to see our vaccine supply increase. As Commissioner Jackson said, the governor has announced that everybody's now eligible to get a vaccine. And while we certainly want our more at-risk communities, people who are older, people who have underlying disease, not to get swept away by the 20-somethings who are now eligible, we do want to try to get as many of us vaccinated as possible, because I think that's really how we're going to win that vaccine variant race. I do want to mention that one of the things that certainly public health officials have been looking at is something called the dial. The dial is a mechanism the state has been using to try to keep our capacity in the community, capacity meaning how many people can be in a restaurant or a church or an office, et cetera, at a safe place. The governor is going to be modifying that next week such that it will no longer be restricting community capacity. And our Board of Health voted tonight, at my request, to allow us to extend a modified version of the dial for 1 month in our area, honestly, because I'm worried about the variants and the increased case rates. And I think if we can just get another month's worth of vaccination under our belt, our future is going to look much more promising. Lastly, I'd like to say, as Commissioner Jackson has already said, COVID prevention behavior, anti-COVID behavior really remains important. When everything begins to open up, please remember the basics. If you're sick, stay home. If you're around people who may not have gotten the vaccine or may be vulnerable, masks are still important. They're still required in Colorado and still required in the Tri-County area, and will be for at least a month or so to come. Please, if you are not aware of somebody else's vaccination status, remember that social distancing can be quite important. And I think we've often forgot about testing because the vaccines are so exciting. But please, if you get a COVID-like illness, please get tested, because you may be able to determine whether you could present a risk to somebody else, and you can help us further keep things under optimal control as we move into the summer. So thanks, Dirk.
Thank you, Dr. Douglas, for your opening remarks and for joining us on this call tonight. Now, for everybody that's on the call, we're queuing up some questions now. If you have one you'd like to ask, all you need to do is press *3 on your telephone keypad to enter the question queue. But before we get to your questions, we'd like to invite Melissa Sager, Tri-County's Policy and Intergovernmental Affairs Manager, to talk a bit about what we can expect to see over the next several months, as well as into the summer. Melissa, welcome to the call.
Thanks, Dirk. Thanks for having me. Happy to be here. And really looking forward to summer weather. I think We're very excited about being able to engage in the great outdoors once again, and are looking forward to the plans that are already being made by lots of folks. We think that while we know that outdoors is significantly safer than indoors, and as our local governments and community organizations plan for this summer, they're keeping that in mind, taking things outdoors, taking advantage of the warm weather. We're working with the county on the county fair. We're working with South Metro Fire on their fire muster this summer, a small event and parade in Littleton. And they're doing things to stay safe. They're thinking through how to keep people at a safe distance, even though it's safer outside. They're thinking through how to keep people home when they're sick, having flexible cancellation policies and multiple events to decrease density, less people, but doing a lot of the things that we love. I've chatted through a lot about events with food vendors and local artists and all types of different events that we're used to. And we think that those things can happen and they can happen safely. And we know that our businesses, again, and our community partners are planning for that. And we're really looking forward to things like the county fair and these small events. And we continue to work with those community partners, discussing innovative ways to approach things this summer. Again, a lot of the things that we know and enjoy looks a little bit different, extra careful. Tri-County did just repeal our outdoor mask order, and so masks not required outdoors. If you're going to be in close contact for a long period of time, if you're on a crowded trailhead outdoors, some of our national parks will require masks under federal requirements, and so not no masks all the time, but certainly a little more leniency there so folks can enjoy time outdoors without those masks. So things continue to evolve in good ways. As Dr. Douglas said, we're being careful still. We're watching things closely. As the commissioner said at the beginning, doing those basics, still washing our hands, staying home when we're sick, getting tested, but really looking forward to those summer activities that we love to engage in.
Thank you very much, Melissa. And I just put it in my calendar, my phone, Arapahoe County Fair, July 22nd through the 25th. Can't wait to go. So it's about time to get into some questions. If you haven't already done so, please press star 3 on your telephone keypad to be connected to an operator. And let's go ahead to our first caller. We've got Valerie joining us from Denver with a question for Dr. Douglas. Valerie, welcome to the call. Go ahead with your question, please.
Hi, thank you. I'm really glad to hear that Arapahoe County is extending the mask wearing stuff for another month. Thank you. I am very concerned, though, because of the rate of the variants expanding, and some of them, as you said, like the one in the UK, is more easily transmitted and people are getting sicker. I also know that there's a variant, I don't remember if it's South America or Africa, that you can still transmit that or get COVID. You can get that variant even if you've already had COVID. That's been proven. And also the younger people are transmitting it again faster, and the younger people are also getting sicker. So what I don't understand is if the way to beat this is to get so many people, as many people as possible vaccinated, and yet we're opening up things before we have this under control. From what I understand, then we are going to hit another wave. So my question really is, why are we opening things up so much when we don't have this under control and we have a lot of new strains coming, in the United States already and rapidly growing?
Yeah, so Valerie, that's a very well put and I think thoughtful and important question. Honestly, the way I say this, I see this rather is trying to find the sweet spot of balance. There are situations, there are states, frankly, where when COVID hit, leadership waited too long to kind of get things closed down. We want to keep things as, and close down right now is, of course, the wrong term because our capacity is opening up more and more. I think the real challenge is trying to find the best balance. We're certainly going to be monitoring the variants, the case rates, and really, most importantly, the hospitalizations. Because as you said, at least in the UK and now in Western Europe, the UK strain does appear to have made people sicker. And I will say that we're looking, the order that our board just asked me to issue will ask me to monitor those things really closely so that if we begin to see any sort of reversal after we begin to open up more fully, we can create more constraints to prevent spread from happening. So, none of us have a crystal ball. We do think the vaccine rollout is incredibly promising, and we think that cautious continuation of the dial and then cautious observation is probably the smartest way forward.
Thank you very much, Dr. Douglas. And again, if you're listening in on this conversation and you have a question you would like to ask, please press *3 on your telephone keypad to get into the question queue. And also joining us on the expert side this evening, we have Meredith Brown, Tri-County Health's public health nurse and COVID-19 vaccine coordinator, who's with us on this call. And Ms. Brown, this next caller is for you. We've got Douglas from Centennial on the line. Douglas, welcome to the call. Go ahead with your question. Hello, Doug.
Oh, sorry, I didn't realize I actually had to talk to somebody. I just want to find out where I can get the Johnson & Johnson vaccine. And also, I've called and tried to set up appointments like 2 or 3 times now and have not heard back from anybody. So I'll take your answer off the air, and thank you so much.
Hi, Doug. Yes, thank you for that question. Unfortunately, the Johnson & Johnson vaccine is still very limited, so it can be challenging to request any specific type of vaccine at an appointment. There are a number of different providers that may have different vaccines depending on each week. And so we recommend that once you're able to get an appointment that you receive the vaccine that's available to you. And of course, you can reach out to the provider when you schedule the appointment to find out which product you will receive. Many providers may still be prioritizing groups that are high risk, but we anticipate over the next weeks and months that all Coloradans will have access to the vaccine. I don't know where you've signed up, but we do have a list of vaccine providers on our website, tchd.org. And I would recommend taking a look at that list and continuing to reach out to those providers, getting yourself on the list for those groups so that as soon as a vaccine is available for you, you can take that appointment and receive your vaccine. Thank you.
Thank you for that information and advice, Ms. Brown. Moving on, next we have Ashley in Arapahoe County. Ashley has a question. I think Dr. Douglas, this one will come to you. Ashley, what is your question? Hello, Ashley. Are you still with us? Not hearing anything from Ashley. Moving on. We'll try and get Ashley's back connected here. We've got Diane from Aurora joining us now. And a good question for Ms. Brown, it looks like. Diane, welcome to the call. Go ahead with your question.
And thank you very much for taking my question. I have a family member who is homebound and is totally in bed. What plans are there that you are planning to get vaccine to these type of homebound people?
Yes, thank you for that question. Tri-County is beginning to vaccinate individuals who are truly homebound and unable to leave their homes for an appointment. We also have a number of partners throughout our 3 counties that have either started some limited home visits or are in the process of those home visits. And so that process is kind of slowly starting via referral through some healthcare providers. So we do have options for those individuals. As I said, it may take some time because it's certainly a different process from folks just coming into a clinic and receiving a vaccine there. But we are beginning that process, and we are working closely with our partners to vaccinate those individuals who are high risk and are unable to leave their homes. Thank you.
So Meredith, stay where you are. Looks like the next caller is for you as well. We are now joined by Barbara in Littleton. Barbara, welcome. What is your question?
Why doesn't Littleton have more sites to get the virus? To get the vaccine. You really have to travel into Denver or way around everywhere, and many people don't drive.
Yes, thank you for that question, Barbara. We absolutely understand that transportation and proximity to a clinic can be a barrier to receiving a vaccine. I would recommend for you and for anyone else who's having trouble receiving the vaccine that you visit our website. You can also reach out to our call center, and we have staff that may be able to help you schedule a vaccine that is closer to your home. Our call center number is 303-220-9200, option 2, option 1. There are providers spread out throughout our counties. Tri-County is also working on a number of fixed sites in the community. So outside of our normal Tri-County clinics, we've also added some off-site fixed sites in areas that we know have where individuals have barriers to receiving the vaccine. So I would encourage you to check our website, reach out to us so you can get on all the lists close to your home and make sure that you receive a vaccine in a timely manner. Thank you.
Thank you very much, Ms. Brown. As a reminder, if you're listening to this conversation on your telephone and you would like to take part in the dialogue, if you have a question, simply press *3 on your phone keypad to enter the question queue. Again, if you're listening on your telephone, all you need to do is press *3 to get into the question queue to ask a question live on this call. If you are listening to this conversation online, you could submit a question right beneath the streaming player. Just enter your name and question and hit enter. Speaking of an online question, our next question comes from Sean, and it's a good one for Dr. Douglas. Sean wonders, will we see a vaccine requirement for travel, Doctor?
Sean, that's a really good and actually practically timely question. There are some airlines that are asking, or at least talking about, let's put it that way, asking people to document either vaccination or test status. That's not by any means a uniform requirement at this point. There are potentially going to be nations that will require those coming in to, again, have either had proof of a negative test or a vaccine. Those are very unlikely to be implemented by the U.S. for outgoing travel. You're probably familiar with the concept and the chatter about a vaccine passport. That's the idea being basically if you've got an easy way to prove that you've been vaccinated, that makes accessing certain services, including travel, easier. President Biden has said, at least at this point, that the federal government is not going to be developing that, although it would be, providing advice to private partners who wish to do that. So I think the way it all boils down is that being vaccinated will probably make travel easier, and in some countries it may actually be necessary for entry, but I don't foresee it being a absolute requirement.
Thank you very much, Doctor. And as a reminder that if you're looking for vaccine information, a great resource is on the web at tchd.org. Again, tchd.org if you're looking for vaccine information. And Dr. Douglas, it looks like our next caller is looking for information from you. We've got Mike from Centennial joining us. Mike, welcome. Go ahead with your question, please.
Yeah, it's kind of a two-part question. Both of them have to do with the variants that are out there. Is the state of Colorado planning on doing a better job of checking the tests, the positive tests, to see what the actual variant population is in the state? And then number two, I've heard that like the UK variant has a tendency to be more, younger children seem to be more susceptible to that also, and which kind of increases the need to know, what the population of that virus is in our community. Because when I look at the dashboard on the state's website, they're tracking those variants, but like right now they're reporting 150 in Arapahoe County, and I'm sure it's probably much higher than that.
Yeah, Mike, this is a really important question because surveillance for variants is something, honestly, the U.S. wasn't thinking about very much at all until about 6 months ago. We're actually quite far behind the Brits. They've got the best genomic sequencing surveillance system in the world. Colorado is making, I'd say, reasonable progress toward increasing surveillance, but it right now is only surveillance. And what I mean by surveillance is they can only test, because of the complexity of the genomic sequencing, a fraction, maybe 3 to 5% of all samples. Now that's a lot better than where we were, but it's very different than every single sample being tested. I don't see us getting there, even though as a public health person, I'd love to see that. So we are still going to be having to draw conclusions based on statistical samples for the foreseeable future. I will say the elementary school children question is an important one, as is the question in general of do any of the variants make people sicker. I'd say the story is reasonably suggestive that the UK variant in particular makes people of all ages sicker. That's certainly what recent analyses out of the UK of about 2 million people tell us. And that's one reason that, again, I feel somewhat cautious about complete reopening as we've got that variant circulating, again, wanting to do it quite cautiously. I don't believe at this point there's any evidence that the other variants, and one of the earlier questioners mentioned one from Brazil, one from South Africa. We've got one from California. There's one circulating in New England from New York. At this point, I don't believe those other variants have showed a predilection for making school kids sicker. But I will note that, honestly, the more infection you have going through the community, even a person who is not likely to get sick has got a greater chance of actually getting infected and therefore getting sick. So some increase with UK, and we're going to be really vigilant about the other variants.
Thank you, Dr. Douglas. Our next caller is Kevin from Deer Trail, and it looks like a question for Melissa Sager. Kevin, welcome to the call. Go ahead with your question, please.
Well, thank you, sir. I am the president of a senior club in Strasburg, and we've been meeting once a month for potluck meetings. And we have about 40 members inside of what could be called a regular classroom. When do you think we can continue with these potlucks again?
Thanks for the question. I'm going to answer part of that, and then I'm going to turn it over to Dr. Douglas to talk about any extra considerations just with older adults gathering. But you can follow indoor event guidance to gather in groups. We really recommend meeting outside if you can. If you are meeting indoors, well-ventilated spaces. And sometimes in those smaller groups with people that you're friends with and close to, it can be difficult to keep your distance, not want to give someone a hug, and if you're eating and in close contact. And so you want to follow those basic rules. If you have questions about how to hold an event safely, we do have a small event and medium-sized event guidance both with the state and with Tri-County. We mentioned our phone number, 303-220-9200, and you can reach out and we'll connect you with some additional guidance. But I will turn it over to Dr. Douglas just for any extra considerations with older adult populations.
so I would agree with what Melissa said, Kevin. I guess what I would add is the CDC is beginning to issue incremental guidance about what can people who've been vaccinated do. I don't know how many people in your senior group have been vaccinated, but I do think that once they get either the J&J or both doses of the other vaccines, and it's been 2 weeks, then their horizons begin to open up. So the CDC's already said, look, if there's small groups, and they really haven't defined how big small is, I think at this point I would not want to get it much more than about 10 or 15, all of whom have been vaccinated, you can get together safely without wearing masks. Now, Melissa's right. The vaccines aren't perfect. They're really good, but they're not perfect. And so I think the ventilation, being outdoors if you can, try to maintain some social distancing can be useful. But I think if you're in a circumstance where you've got a lot of, really pretty much everybody's been vaccinated, I think your horizons begin to expand. They do say that vaccinated people can hang out again in small numbers with unvaccinated people who are not at high risk. I would say anybody who's considers themselves a senior is probably old enough that if they're not vaccinated, they ought to be more careful at this point in time about gathering in those potlucks. But I'm glad you're asking the question because I think we're getting back to the time when this is going to be more and more part of our normal lives.
Thank you, Dr. Douglas. And a quick time check. We're about halfway through tonight's live telephone town hall. If you've got a question, now's a great time to press *3 on your telephone keypad to enter the question queue and ask your question live on this call. Again, press *3 on your telephone keypad to ask a question live on this call. I'd also like to remind you there are 2 places where you can find up-to-date information on COVID transmission and safety practices, as well as vaccination information. The first is the Tri-County Health Department's website. It's easy to find at tchd.org. Again, tchd.org. There you'll see a banner at the top of the website, and that'll take you to the COVID section. Now, the second website is the state's COVID site, and that's located at covid19.colorado.gov. Again, the state's website, COVID-19, that's the number 1, the number 9, .colorado.gov. And now let's go ahead and get back to some more questions. And we've got Jeanette from Centennial with a question for Dr. Douglas. Jeanette, welcome to the call. Go ahead, you're live.
Dr. Douglas, hi. I have tinnitus, and I got my first Moderna shot, and it made it a lot worse. And so I'm terrified to get the second shot. What should I do, and how protected would I be if I just stopped where I am with just the first Moderna shot?
Jeanette, I'm really sorry to hear about that. There are beginning to be some reports of tinnitus following vaccination. I will say at this point I haven't heard a statistical analysis that tells if they think this is occurring common enough to be definitely related to the vaccine or just a coincidence, because we do see, frankly, coincidences that happen with background things. Now, having said that, if you got tinnitus, or rather if you had it and it got worse, I'd want to be somewhat careful. We probably don't have time on the town hall for me to take a more thorough medical history from you about how the tinnitus has evolved, if it's gotten mostly better, or that might make me a little more encouraged about getting the second dose. If it has not gotten better, I would want to be a little more careful. I think this is probably something, if you've got a healthcare provider who helps you with this problem, to talk to about. I will say, however, that there's increasing evidence that, at least in the short term, a single dose is fairly highly protective. CDC released some data about a week ago that said after your first dose, after 14 days, short term, your protection level's up to about 90%. So all of that is to say it's a little hard to know about somebody in your circumstance. Probably the best thing is to talk it through with an individual provider, but you have time. In other words, you've already gotten some protection, and even though we say get your second Moderna 4 weeks later, we know that's not an absolute, and I think you've got time to kind of talk through the pros and cons with somebody who can help you with the specifics of your individual situation.
Thank you, Doctor. Moving on, we've got Kevin joining us from Denver with a question for Melissa. Kevin, welcome. Go ahead with your question, please.
Hi. The question is going to relate to swimming pools, public swimming pools, and whether or not the HOAs should open these up, and what would be recommendations. My concerns is that when you do swimming in a pool, something like that, there are bodily fluids that people are constantly touching their noses and so on. So my concern is, are we going to be in a situation where keeping them closed or recommendations by opening them? And I'd like to hear what they are. Thank you.
Thanks for the question, Kevin, and we get a lot of questions about this. We're excited to have our pools open, one of those outdoor activities that we know is much safer than those indoor activities. Dr. Douglas referenced a new local public health order scheduled for April 16th. The state does plan to rescind many of their restrictions, at which point Tri-County has put together a much briefer public health order that has requirements for all sectors. And so many of those things that were included in the statewide order for our pools, like hourly cleaning, collecting contact information, reservations, they're not going to be strictly required after April 16th. And so it is going to open up some abilities for our local pools. Our pools are very different, and so while reservations are not going to be required, if you go to a very large community pool that's very popular, there may still be a reservation system in place because some of those basics like 6-foot distancing, staying home when you're sick, they will still be in place, and so our pools will still have to account for that. Kevin, to your point about bodily fluids, we do think our pools are safe. They are treated with chemicals and they are inspected by Tri-County. I won't speak to that. I'm not the expert there. But there is CDC guidance there as well that does go through and explain that our pools are safe when it comes to things like bodily fluids. Reach out if you'd like some more information on that.
All right, our next question comes from Fletcher in Aurora. Looks like a good question for Dr. Douglas. Fletcher, welcome. Go ahead with your question.
Hi, I'm 70, and I have had both of my vaccines. About the second one was about 6 weeks ago. I have psoriatic arthritis, and I use Remicade for care from my rheumatologist. I work part-time at one of the big box stores here in Aurora, and I'm just wondering if it is okay to go back, part-time to work.
Fletcher, really good question. I'm delighted to hear you're feeling well enough with your psoriatic arthritis at 70 to keep working. That's great. I think the general answer is you are probably okay to go back to work. I would, however, I assume you've got a healthcare provider, a rheumatologist maybe, who's providing care for you, who probably knows your condition, maybe how your blood counts are doing and this kind of thing. And I think it would be, all things being equal, smart to consult with them and get their opinion. Again, you are likely to be very highly protected, but because you're immunosuppressed, your response to the vaccine may not have been quite as good as somebody who was not immunosuppressed. And I think they might be better able to help you kind of sort through the pros and cons. One thing I would suggest, if your rheumatologist says, Fletcher, I don't know, go talk to public health. I think if the setting is such that you can stay reasonably distanced from people, as Melissa described earlier, and if it was me, I've got a sister-in-law with a bad rheumatologic condition who's post-vaccine, and I advise her to wear a mask in public places. And I think to provide yourself some extra protection, that would probably be a reasonable idea as well. But again, probably talking to your doc first is maybe the most individually appropriate thing to do.
So next up is an online question for Melissa Sager. John writes, do kids in high school have to wear masks for sports this spring?
We get that question a lot too, and we know our sports are very important in the community. It's going to depend on your setting. Most indoor sports are going to still require that mask while playing, but updated public health orders regarding masking were just released both at the state and local level here at Tri-County, and outdoor masks will not be required. That was required under our local order, and just acknowledging that those outdoor spaces are significantly safer than indoor spaces. When you are around large groups of people, you want to wear that mask whenever you can. If you're a spectator and it's not too much trouble and there are other spectators around, always good to throw it on as an extra layer of protection, trailheads, things like that. Otherwise, it's not going to be required under public health orders.
Thank you, Melissa. Next, we're joined on the line by Burma in Aurora. Looks like a good question for Ms. Brown. Burma, go ahead with your question, please.
Thank you for taking my question. My husband and I are getting ready to get our vaccine, and I'm wondering, even though we're not sick, should we be tested before we do the vaccine?
Hi, Burma. Thank you for that question. The CDC does not recommend getting tested before receiving the vaccine. Certainly, if you were feeling sick, having any symptoms of COVID-19, or had a recent known exposure to COVID-19, then we would encourage you to get tested. But if you do not have any symptoms and haven't recently been exposed, then there is no need to get a test before receiving your vaccine. Thank you.
All right. Next up, we've got Cindy joining us from Greenwood Village. Cindy, welcome to the call. Looks like you got a question for Dr. Douglas. Go right ahead.
Hi, my question is, I am healthy and I've had both of my Pfizer vaccines. Why do I need to continue to wear a mask?
Cindy, the main reason for recommending masks in indoor settings at this point in time, even among vaccinated people, outside of, by the way, I would say your a personal setting, is that you can still get infected yourself, and you could get sick, although that chance is quite low. You could also get an asymptomatic infection and transmit infection to other people. Now, I want to be clear, the news is getting better and better, that the likelihood of that latter scenario is less and less. In other words, although the big clinical trials at the beginning weren't set up to determine if the vaccine prevented asymptomatic infection, they were only set up to see if it kept you from getting sick. Subsequent studies are beginning to show that is very likely to be reduced. I guess the other thing I would note is that while we do think the current generation of variants does appear to be prevented by vaccines, we know that there are some variants. There's one in India that was identified recently. We don't think we've got it in the U.S. that may not respond as well to vaccines. So at least at this point in time, that caution is continuing. That's not going to go on forever, let me say, because honestly, the vaccines are going to become our primary mode of protection. But as a secondary mode of protection and transmission to others, that's the reason for the recommendation at this point in time.
Thank you, Dr. Douglas. And as a reminder, if you'd like to ask a question live on this call, please press star 3 on your telephone keypad right now to enter the question queue. Again, star 3 if you'd like to ask a question live on this call. If you're listening to this conversation online, all you need to do is submit your question right below the streaming player. And next up, we do have an online question. This one was submitted by Joshua, and it looks like a good one for Melissa. And Joshua wonders, is there any way to allow visitation to nursing homes to help encourage and support the elders?
It's a fantastic question. The state has been looking at this and is opening visitation in our congregate care living facilities. It is going to depend on the facility vaccination rate, if they feel comfortable having visitors in, whether or not they're experiencing cases. But they are permitted to have visitors. Reach out if you have additional questions. We have a team at Tri-County dedicated to working with our long-term care facilities, and I can provide a bit more information through that group. If you reach out to our call center, 303-220-9200, they'll connect you to the right group, and we can get you some additional information.
All right, let's move back to the phones. We've got Stephen from Centennial on the line with us. Looks like a question for you, Dr. Douglas. Go ahead, Stephen, you're live. Hello, Stephen.
Yeah, can you hear me?
Yes, sir. You're live on the call. Go ahead.
All right, so my question is when we should expect to see herd immunity.
So, Stephen, herd immunity is sort of like the Holy Grail. We're all wanting to get there. The concept basically is if enough of us short of 100% become immune, either through natural infection or vaccination, there's not enough susceptible people around for the virus to keep spreading. The best estimates are that we need about 70 to 85% of us to have immunity to prevent that from happening. Now, that's a pretty broad range. And part of the reason for the broadness of the range are the variants. If they are more transmissible, then we will need more of us to be protected. The other part of the equation is that natural infection probably contributes somewhat to herd immunity. And so we don't necessarily, in a short-term way, need to get everybody vaccinated, like 85% to get there, if we have enough naturally infected people. The problem with that is that we think natural infection doesn't last as long as vaccine-induced protection. So that's a lot of gobbledygook to say. I think we're probably not going to get to a place where we see enough of us immune to not have circulating virus, probably until at least late summer or fall. And then, unfortunately, it'll depend on the variant story. If we get new variants thrown at us, we'll be probably needing to use a new generation of vaccines to try to enhance that. So really important question, complicated story, but that's the general time frame I would expect.
So next we're heading out to Watkins, where we've got Karen on the line with us, and a good question for Melissa. Karen, welcome to the call. Go ahead with your question.
Hi, I just wanted to know, we have a big ranch that we do business and stuff on that we've been closed down for COVID. With summer coming, we kind of want to start getting things moving again. For the most part, we're usually outside, but I just wanted to know, what you guys would require for, the youth programs. How many kids at a program? Would that be something you'd recognize? Should we hold off another season? We do lessons for horses. I mean, we're the whole caboodle.
Thanks for reaching out, Karen. I think absolutely we want you to be doing those activities, especially those outdoor activities. Again, just really looking forward to summer coming. It's going to depend on your operations, and we are expecting additional guidance from the state regarding some of those youth programs that fall under child care guidance or youth camp guidance. And we do expect some additional information from the state. Our child care and school team is following that issue closely and continues to follow up with the state. If we're not getting, we're already planning additional guidance in that space from Tri-County. And so reach out with specific questions. It's permitted currently under current restrictions, and so we can certainly connect you with those and then provide a bit more information on what we expect to come. So reach out with those questions, and we're happy to connect you with some more information.
Thank you, Melissa. And it looks like time is winding down, so if you're thinking you have a question you want to get in, now is the time. You've got to press *3 on your telephone keypad to enter the question queue to ask your question tonight, live on this call. Again, press *3 to enter the question queue. And next up, we've got Henry from Aurora joining us with a question for Dr. Douglas. Henry, go ahead with your question.
My wife and I are 70 years old. We've had both of our Moderna shots about a month ago. And what I read is that the variants may require Moderna to do a booster or another shot. I'd just like to know what the thoughts are right now. One, when that might happen, and two, how necessary will it be for us to get additional shots?
Henry, that's a hugely important question, and it's one that we're still trying to get answered. You're right, Moderna and also Pfizer are trying to develop, or in fact have developed and are beginning to test booster doses. I think the question is going to depend, how does the original vaccine appear to be performing over time? And there are studies underway to see whether or not people who get exposed to variants begin to get breakthrough infections at a higher rate than we would have expected. And then the second part of the equation is, how quickly will we know that the boosters are safe, which I'm sure they will be because they're based on the same stuff as the original vaccine, and effective. That'll probably take a little longer. Rolling all that up together, I think we might be needing boosters in the future. I don't think we're going to have enough information about when and how to do that, at least until the fall. That's a kind of a rough guess, but that's the kind of time frame I'd be thinking about.
Thank you, Dr. Douglas. Moving on next, a question for Melissa Sager, it looks like. We've got Sandra in Aurora joining us. Sandra, welcome to the call. You're live. Go ahead with your question.
Hi. My question is, when do you expect the larger hotel resort style ones that host the weddings and all the events to open fully, with us getting close to a lot of folks being vaccinated?
Thanks for the question, Sandra. Our hotels are definitely having greater openings now. More is permissible under the current level in the county, level blue. That will continue on within the county, and greater allowances are available depending on the setting. So if it's a seated event with a bit more control in that space, they'll be able to have additional people. We will still see that 6-foot distancing in place, as well as a few other restrictions. And so operations still look a bit restricted, but we are moving toward that greater reopening, emphasizing activities outdoors, which we know many of our hotel spaces are utilizing as well. So increased reopening. If you have questions about a specific event or activity, we're happy to go through that with you, go through what's to come and how it fits in. So reach out, happy to provide more information.
Moving on, we've got Tom in Inglewood on the line with us right now with a good question for Dr. Douglas. Tom, go ahead, sir.
Hi, Dr. Douglas. I was curious. I'm 65 years old, and I've been waiting for I think it's a Pfizer shot, the one where you only get one shot, and I can't remember the name of it. And Johnson & Johnson, I guess it is, my wife's telling me. But anyhow, now I see on the news that they're having a lot of problems with that particular immunization shots, that people are having extremely a lot more than the other doses of other vaccines. In other words, what I was trying to do is prevent from having to go out. I'm pretty much homebound, except for I can get out. And I was hoping just to get the one shot, but now I'm scared all to hell.
Yeah, Tom, thanks for asking it. This question about the safety of the Johnson & Johnson vaccine, your wife's right, listen to her, was in the news yesterday. The attractiveness of the Johnson & Johnson vaccine, it's a one shot, so for somebody that's having trouble getting out, that's a really great option. It is, as Meredith said, in somewhat unpredictable supply, but Dick's Sporting Goods has had it. Now, what happened yesterday, as far as we can tell, is that out of about 1,700 people that got vaccinated, 11 people had a reaction, two of whom the docs there were concerned enough they had him go to the hospital. There does not at this point appear to be any concerning explanation about this. We do expect that people who get vaccines will sometimes have side effects. One of them can be getting lightheaded and even fainting, and that does appear to be, at least based on the preliminary information so far, what happened there. So I think it's appropriate for you to be concerned and ask questions. I would say that if I had a relative that was having trouble getting vaccines, wanted to get a one shot and they could get it tomorrow, I'm satisfied based on what I've seen so far that Johnson & Johnson would be safe to receive. But I will acknowledge that the vaccine journey is one that we continue to learn about. I think the safety record has been very solid, but we'll continue as doctors and public health people to keep our eyes open about that. But if you're still thinking about it, I think you could comfortably go ahead and get the vaccine.
Thanks, Dr. Douglas. Stay where you are because our next caller's got a question for you. It's Chris in Aurora. Chris, welcome to the call. Go ahead with your question.
Yeah, I think you already answered it. It was basically after I get my first or second shot and wait the appropriate time, can I still get and transmit COVID? Thank you.
The simple answer is yes. Even after a first dose, there is some transmission reduction value. It's not as good as after a second dose. And after a second dose, it may be getting up to 90+%.
All right, and looking at the clock, looks like we have time for just one more question. Teresa in Aurora is on the line with us for a question for Dr. Douglas. Teresa, welcome. What is your question?
Hi. My question is that I've been watching the statistics over the last 4 weeks with Texas opening up fully in their state and their numbers declining as to hospital COVID, hospital, what do I say, being admitted for COVID dropping. When is Colorado or at another level, Arapahoe County going to start looking at the idea that the citizens should be able to self-regulate, and make those decisions upon themselves rather than be forced to submit to rules by the government?
Great question, being actively asked. I'm also looking at Texas. Things have gone quite well there since the governor lifted their orders. I'm also looking at Michigan, New York, places where it hasn't gotten so well. I will tell you practically that the Tri-County public health order that I mentioned, which would extend the dial restrictions for another month, would go from April 16th until May 15th. At that point, if we didn't see a resurgence in serious illness due to variant strains, that's when Arapahoe County is scheduled to have no restrictions in terms of community capacity at all. We, of course, will monitor the situation. We'll monitor the variants, hospitalizations, but that's roughly the trajectory now of Arapahoe County being fully reopened in terms of community capacity.
Thank you, Dr. Douglas. We have covered a lot of ground tonight, and our time is almost up. I'd like to turn things over now to Arapahoe County Commissioner Pro Tem Carrie Warren-Gully for some closing remarks.
Thank you all for joining us tonight, and thank you to our guests for providing such valuable information and advice. We hope you've been able to clarify any questions or concerns you have, and we urge everyone to review and follow the guidelines closely and to stay safe and healthy this spring by continuing to take the necessary steps to protect yourselves and your families. For the most up-to-date information about our COVID rates and vaccines, please continue to visit tchd.org. Again, thank you so much for joining us, and thank you so much to our guests for being here this evening. Off to you, Dirk.
Thank you. I'll echo that to everybody. Thank you for joining us and participating. We hope you enjoyed this COVID-19 telephone town hall. As a reminder, we'll post a copy of this recording to our website in the next 24 hours. Have a good night.